name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to have CEO and founder of OneImaging, Elan Adler, back for his second episode. This is going to be a fun one. We're doing a little bit different format, and I hope you enjoy.
Thank you. Good to be back on and chat, Norm.
I love it. So Elan, big news in the digital health space is your Series A round just closed recently and was announced recently. Can you catch up all of our viewers and listeners that are excited to hear about OneImaging's growth on what that Series A was all about, and what do they have to look forward to coming out of OneImaging over the coming months and years?
Yeah, so super excited. We closed a $31 million Series A, and takes us to a total of $38 million in funding to date. And we're able to bring on some unbelievable people onto the cap table, such as VY Capital, who led the round, who just bring a wealth of knowledge. And this capital supports OneImaging scaling. We closed some pretty big deals in this past year, and we were thinking, what do we do? Should we wait it out a little bit longer? And ultimately, we felt it was the right time, so went out to market. And 6 weeks later, we basically walked away and closed up the round, and basically held off on announcing it for a while. Because it's sales season right now, so didn't want it to be much of a distraction. So waited until October to get the news out, but very excited to welcome new investors onto the team and just blow the company up further from here.
I love to see it and hear it. VY has a great track record in healthcare, but also tech in general. Got a handful of big IPOs under their belt with portfolio companies, and they've worked with some of the most innovative tech companies around. Walk me through why VY? Why'd you choose them, and how is that going to really help take OneImaging to the next level?
Funny enough, I think a lot of it is actually a personality fit. Mm-hmm. We went out, we received a couple of term sheets for leads, and we were running a process, and there were a couple of other funds that do a lot in healthcare that were pretty interested as well. And there was the terms we wanted were the terms we got. And it wasn't just that though, it was the way that this group looks at themselves is like an extension of your team. And they make a small amount of investments, but when they invest big. I thought that for this round, I really wanted someone who has seen companies that have scaled past a 10 billion plus enterprise value, and that's part of their thesis. Mm-hmm. And have a lot more knowledge just outside of healthcare as well in general that I thought were really applicable. I mean, a new way that I've started to think about how I think about OneImaging is that we are a tech company, and because we save people money, it allows us to have distribution through insurance, but a tech company first and foremost, as we look at our bigger and broader missions and visions for the company. And that really aligned. It also really aligned that our mission is really to bring in competition. And I always say this, to bring capitalism into healthcare. And that aligns very well with kind of how they view things of increased access brings competition, creates better quality, creates better pricing, and benefits the consumer really well. And so there are a bunch of things from a business perspective. And just, I think beyond that, really good people, very transparent people. People have had their own experiences with healthcare. The partner who led the deal, his dad's a radiologist, for example. So there's a personal connection. Mm-hmm. There's the understanding of it. They are an investor in Biograph and the whole body imaging space. So they had a lot of knowledge in the space as well, which was super helpful. And then they just know a ton when it comes to AI, distribution, many different things that are super pertinent that I think I want to know a lot more about. And these are just great folks who really believe in improving humanity overall. And so it just made a great fit. So super excited to have them. And we're able to bring in some additional amazing other folks, Dylan Field from Figma, John Oranger from Shutterstock. And those are the types of folks as well that they've also done it, right? And I can lean on them and say, hey, what do you think I should do next? Or, I'll never forget, we were in an executive offsite in San Francisco, and I was meeting Dylan, and I was like, hey, the team's actually in the other room, and I'm wearing the shirt. We just did a whole redesign and brand refresh. And I said, hey, do you want to pop into the other room and you want to see the new design we're doing? The new UX UI, we have Figma pulled up right now on the big screen.
Nice.
And that was a special moment to be able to like say, hey, what do you think about this? So there's just some amazing opportunities that we've been able to have with this new round that are broader and go beyond just healthcare insurance.
Yeah, it has to feel very surreal, just like with like where these people have been and the fact that like they take big swings and they think OneImaging's just a big swing, future winner, and a really big way to transform how healthcare is consumer centric going forward. So talk to me about some of the growth. Like the growth is explosive. I'm happy to share the statistics myself, but I think it comes better from you. Walk us through some of this amazing trajectory of growth, because 3 years ago, like company was in a very different spot than where it is now.
Yeah, we will cross 2 million lives this upcoming year, and that was a big piece of it. And I think a year and a half ago, we had 0 health plan integrations. Now we're integrated with every carrier. And if we're not, and if it's a smaller carrier, we know how to do it really quickly now. And there's like a template. So that's super, that was big for me. And that just unlocks more floodgates, right? Because you can go to a group and you can say, hey, we already have a scalable templated integration. When we go to their account teams, we say, oh, we actually already work with you guys. And it makes life easier for the employers. It makes life easier for the payers. And so that's unlocked a lot as well. And the utilization of the product has gone up quite a bit as well. And our completion rate on exams just broke a record this past month, where 80% of exams are getting completed in under 30 days. And this is a logistics business, right? And so we need automation and engineering to make all this happen. But that's kind of what accelerated it and kind of where we're going from here.
That's fantastic. 2 million lives within 3 years of launching the business is just insane. I don't know if another digital health company's done it. So like kudos to you and your team, just an incredible team that I've really gotten to know well over the last couple of years now. Walk us through customer growth. Like where was it a year, 2 years ago? Where are we at now? And where do you think it could go?
We're at a couple 100,000 lives, like 200,000 or something like that. And then it was really when we started to pick up steam with larger employers that we were able to get into this world where we could get closer relationships with the payers. And I give so much credit and kudos to the benefits leaders in the space, who a lot of people don't realize, they're making decisions for many football stadiums filled worth of people in some occasions, right? And the impact that they can have on their employees is so dramatic, and that these folks are courageous enough to take that jump for the betterment of their employees, to make things cost less, to have a better experience, to have higher quality. And so once we started to get the first large employer, then it was easier to get the next large employer, and then the next one and the next one. You have to establish trust really in the industry with folks. And so when we were able to start establishing trust and show this thing works, it works well, and it's only getting better, this is only the ground floor, that's when it just kept on coming in. It went from outbound to getting inbound, or people reaching out to our investors asking for introductions. And then we started to get partnerships in place with folks, and that accelerated growth quite a bit. And so made it easier to contract and do other things. And that's just how it went.
I love it. Are you at liberty to share like what January 1 will look like for new implementations? Because usually there's a lot of like open enrollment ones, and then also educating the viewers and listeners that you guys can do off cycle, you have done off cycle as well.
Yeah, we have 52 implementations slotted for this January.
I don't know if there's any other digital health company that has that happening. So like crazy kudos. You should be so proud. I'm very proud of you. Like it's just amazing to have seen this thing take off, and it's been the joy of my career to watch it.
No, I appreciate it. And kudos to my team. They've done some pretty amazing things. They've created tooling recently to automate implementations, which is incredible, that allow us to do more and do it more efficiently. And yeah, then the other component is we have a ton of additional implementations slotted for start of Q2. It's really kind of like a quarterly basis. There's some that start in March. I don't know if that's just based on their benefit cycle or whatever the case is. But we have, implementations in March, April. We have some in June again, which is not really necessarily on the quarterly. And then we have some in July that are already slotted. So that is something that's awesome, that we're able to go off cycle, and it keeps things fresh, and it makes us have to innovate more because we go off cycle. So, okay, we've got another 5 or 10 slotted for Q3. What more can we improve before that? So I love that part about the business as well.
And talk to us about the outcomes, both financial and clinical. You talked about like we're seeing increases in engagement, which at scale is going to save more money for the employer, plus get more access for the patient, thus saving some downstream costs, allowing you to catch certain diagnoses a hell of a lot earlier, because you said like 80% are done within 30 days, which is fantastic. Walk us through both the clinical and economic impact that you guys are able to make at clients. I don't know many companies that drive this amount of cost savings and patient outcomes.
Yeah, so imaging is the second most used service in healthcare. I never even talk about this part, but imaging is really moving in this direction now. It should be the first and focal point in healthcare, right? If you hurt your knee skiing, as someone on my team did who's going to listen to this, the first thing that they should do is get an MRI of their knee. And now that it's not as cost prohibitive to the plan and to the member, it makes sense to actually move that and make sure that's the number one thing to do, because it often costs a lot less than other things you would do in care. And also, like if you were to start doing exercise or the other types of things, and you might have a partially torn ACL, isn't a tear. So like from a clinical perspective, we're able to make sure people get that diagnosis right away and know the right thing to do, and make sure that they go to the right next care pathway. So something that's really cool is we've seen some data that we're the largest referrer into that next care pathway, whether that's like a surgery COE or a digital PT solution, whatever it might be. So that's like something that's awesome. That's just like a byproduct as well. But outside of that, we're driving 65 to 68% average year-to-date savings on exams. And that's kind of the big factor, right? It's just same exam, same thing. Your doctor gets the results the same way, and that's just a huge cost savings when you're looking at a $2,000, $3,000, $4,000 MRI or CT. I mean, the savings are like 80+% in that type of situation, and that can often be the case. And so that's where we're seeing just really, really good cost savings for folks and helping them get their appointment quicker. So, another thing is, and I often go back to the example with my dad or others, which is there's like this issue where you might go to a specialist or a doc and they're just referring to the same place because their employer might want them to, which is a disservice to the patient, but B, that actually starts to create a backlog. So now that same center or provider may have a wait list or a backlog that's 6 weeks, 8 weeks, 9 weeks. I mean, I've heard of health systems that are renting MRIs in the back of trailers, which is honestly not a great experience at all, to cover the backlog. And that's what they did at Cleveland Clinic when I worked for the Cleveland Clinic in Florida once upon a time, is they literally had an MRI trailer because their 3 MRI machines were not enough for all, the South Florida ecosystem that they were covering. And it still wasn't enough, by the way. So you're creating this backlog, but if you give people choice of where they go, then essentially you have availability and options to no longer wait 6-8 weeks. And you can get your appointment in 1 week. And as a result of that, we also see data that people are much more likely to adhere to the prescription, because it is actually a prescription, to get that MRI or CT or ultrasound. So it's pretty interesting. You can see a drop off when people wait longer. So, right, if it's a mammogram, how do you increase adherence to mammogram screenings where there's some crazy statistic where like 99% of people who get mammograms catch cancer or like way earlier and survive as opposed to not? And don't quote me on that. I don't know the exact number. But so when you're looking at quality and cost reduction, these things all factor in. And we don't even talk at all about downstream stuff, and it's not part of our value prop at all. But these are some of the things that we're able to help address. And so people can get that lower in cost, get it much quicker. It's potentially life-saving. So there's, obviously enhanced outcomes, lower cost, and better experience. They also go closer to their home. Don't worry about authorization. That's also a huge disconnect that I forgot to mention, is doctor submits the auth, rendering provider has to submit the auth. Oh, there's missing clinical information. What do we do? And now it goes back and forth between two parties. So we're really bridging the gap. We take care of everything for everyone.
I love it. And what you shared with the longer out it's scheduled, the less adherence there is. It's just one of those out of sight, out of mind. Like if it's not something recent, they might not remember the severity of like what a diagnosis could be, and catching it early, like how it can really improve your life expectancy if you're able to catch it early, which is just so crucial. And then can you talk about the financial impact, like the 60 to 80% cost savings, and you guys are getting closer and closer to 80 as you do more and more in these and keep improving every single quarter. But what about the cost savings? Like for employers of a certain size, you guys go at risk on your deals. You're willing to, put your money where your mouth is and go at risk. Walk us through like what the average savings is for an employer of a certain size.
Yeah, I wouldn't say at risk is necessarily the right word, but I would say, of course, like many solutions, we have two models, which is you can do a subscription model. That's one where we'll go at risk, but the other is we don't make money unless we save you money, and so we want to guarantee that that's the case no matter what financial model you choose with us, right? And that's like a big belief. There's enough folks out there grifting the system, and we would just want to make sure and be very clear that we're transparent. It's a transparent pass-through of our services, and that we only get any benefit when we create substantial benefit, a huge return for you, the purchaser of our services, right? And so I look at it as like 4 different tiers, right? Depending on how deep you integrate with us. And it can be as high as a 2.7 to 3% total reduction in MLR at the highest end. To the next case down, we have folks that are choosing to mandate OneImaging, which generates millions for every 10,000 lives, and then we have a layer down from that, which is less millions for 10,000 lives. It's it depends on how deep you want to integrate us, and we see a lot of folks that just say like, wait, the deepest level of integration is actually the least abrasive. It's the best member experience. The orders come to us directly from ordering doctors. And so from that angle, the members aren't confused. It's more organic, it's more natural. And so it depends on like the level you want to go with us. And we can offer, it's kind of a little bit of a menu. And it's how much do you want to maximize this? And again, the irony is the deeper you go with it, the better the experience for your employees, right? Or for the consumers of healthcare, the patients. And that's what we really want to focus on is, how do we make this really just be super geared as a product for consumers that they like love? Like my goal would be that someone's like, yeah, I'm using OneImaging. The ideal situation in, a year, 2, 3 years, whatever it is, that we have additional offerings to consumers, members of the product, and they look at it more than just a cost savings tool. But how do I actually own and control all the imaging data I've had? That's why we call it OneImaging, the one place for all your imaging needs, where they're going to their employer and they're saying, hey, could we also have this? Can we also get this? Like, I want to be very unique in that regard and be super obsessive with the consumer, where people are asking their HR leaders for a product. And I could be ignorant, but I don't think it's super common. So it's something that I'd love to, a place in which
fertility is like the one area that is requested pretty regularly, but in most cases, most digital health companies are not getting that inbound, so to speak.
I actually have heard that, but leads us to our next thing. I actually want to, I think, as we mentioned earlier, I'd love to flip the script here. I'd love to talk about healthcare. I'd love to talk about you. And for everyone listening, Elan is going to take over the role as the host of the Digital Health Heavyweights podcast for this episode.
I love it.
Norm, you've been working on a lot of exciting things this past year and I'm super happy for you about that. And super happy to be an early participant of what you've created. Do you want to go and tell the listeners what that is that we're talking about?
Yeah, absolutely. So, my first 15 years of my career were all spent exclusively doing executive search. Lucky to have spent the last 10, 11 years in employee benefits and health plan sponsored benefits. And I've started, start the venture capital side of our business, because ultimately it's been great working with the Livongos, the Hinges, the Liras, the Vertas, the Progenies, the many companies that have done really, really well in this industry, and have learned just so much from working closely with a lot of their executives. But I started to feel like I could kind of predict which companies would do well and why, because a lot of the pattern recognition and a lot of just being in the space, talking to people day in, day out, probably have 10 to 12 conversations a day. You multiply that over 250 work days times 10 years, you start to have a lot of data points. So we started MVP Growth Partners along with my co-founders, Jason Perot and Manny Menendez, and would love to discuss and kind of explain how we started it, as well as our experience so far and some of the success we've had.
Yeah, so I was gonna ask, how did that come about? Feel free to share the background and the backstory here, and I'm happy to tag team in with you and help you answer your own question a bit if you'd like. But I'm sure everyone would love to hear from you how this got started.
Yeah, it's purely a passion project, and the great thing about placing 4 people at Livongo and Hinge combined, and many dozens of other unicorns, is when you go to these conferences, you go to Health, you go to Conference Board, you go to BGH, you go to the Vive conference, EHIR events. You see these people 3, 4, 5 times a year. And I was starting to get bruised ribs a little bit because I was getting these bear hugs from people saying, hey, Norm, if it wasn't for you and your team, I would be in a completely different place in my career. And oh, by the way, did you know my equity that we negotiated hard for, when it came to offer negotiation time, that equity is worth millions now. And that was like the best feeling you could possibly have as a recruiter. And like still to this day, warms my heart. Every single person we're able to help get into a better career situation than they were in before. But when that is the case, you start to realize the way people are really generating economic growth in this space, most of it's actually on the equity side for the people working for the best companies. Their W-2s over the years pale in comparison to what they can achieve with just having equity in one of these companies. So I started to ask myself, I'm like, Norm, when you met Livongo 12 years ago or 11 years ago, when you met Hinge 9, 10 years ago, whenever it was, how confident were you that they were going to succeed? And the answer was, and again, people can say, oh yeah, like 2020.
Okay, that one would have been a tough one to predict, like, very early in digital health.
Fair. But I had a lot of conviction, and that's what helped us do great work for them. And I asked myself, like, why didn't you ask to invest? And I would say at the moment, in those times, it was pure ignorance. I wasn't even thinking about it, wasn't on my radar. So over the last 4 or 5 years, I started to ask myself, all right, if you ever get that chance, if you ever meet a company that you think is that next Livongo or Hinge, you owe it to yourself to ask. So maybe 4 years ago, I started investing in venture funds that I was already partnering with. They were already referring me a lot of business because they respected what we had done within the space. And that was a great entry point into the investment world. And as I started to learn more and I started to see more, it really became clear to me that relationships are a huge advantage, specifically at a very early stage investment time horizon. So while these things are bubbling up in my head, I go to Health a little over 2 years ago. It's late October of 2023. And my first meeting on that Sunday is at the happy hour that Health was putting on. It was in the back of the Wynn, kind of on that fake grass area. I'm looking at this new sphere, and I meet this person with just so much energy and so much excitement about what he's doing. That person happened to be you, Elan. And I remember you pitched me OneImaging for the first time, and my skin started to literally get goosebumps. Because when you were talking, my body, my mind, everything I remembered transformed me to when I was talking to Dan and Gabriel at Hinge for the first time. When I met them, they had a couple of pilots, they might have had a couple of paying customers, they had one salesperson, and again, Dan and Gabriel, I apologize, but I took the meeting as a favor to Jim Pursley. Jim's like, hey, I'm advising these 2 entrepreneurs, I think you could help them. I did not know I would be talking to 2 future, founders of a unicorn. But anyways, as you're describing what imaging and what OneImaging was going to be and what you were trying to accomplish and the conviction you had and all of these statistics you threw out and how well you articulated your value prop, it reminded me of a lot of the greats I had worked with previously. So I saw two main things. I saw the conviction, I saw the great business model, I saw the foresight to create something that had like massive impact and massive value for the employer. But also I saw you and your passion and your excitement and your subject matter expertise and your ability to create connection, get people excited, your ability to, really build strong relationships and trust in a very short period of time. So I remember asking you 2 minutes into meeting you, can I invest? And you can share, what your recollection was of your response, but I'll let you chime in.
Yeah, no, it's interesting to hear your perspective and appreciate the kind words. I don't think I've heard what was going on in your head when that was happening, but yeah, you made a proposition really quickly. And if you remember, I tried talking you out of it.
Mm-hmm.
That was not a sales tactic, by the way.
Yeah.
Do you remember that?
A little bit. I remember saying, Elon, I'm going to tell you something pretty surprising. I think that was the best early stage pitch I've heard in 8.5 years. And the two people I'm referring to are, the Hinge founders. Mm-hmm. And that definitely got a little bit of a blush from you. I think you knew what that meant. And I think you could tell like that was genuine. That wasn't just me gassing you up.
You seem very serious, but I remember I tried, I was like, are you sure?
Mm-hmm.
I mean, I suppose like I could send you over information. And then sure enough, became an angel in the pre-seed round, and was super excited for you when you started MVP. And I remember the help that it was. I think a lot of people don't understand that you could have the best idea in the world. You could also even have the best product in the world, but it doesn't matter if people don't use it or people don't have it or it's not out there. And that requires a team to get it out there. And so simply you could have the best idea or the best product, and it's simply the best idea or the best product that no one's using. And so because that, a company is only as good as its people. Mm-hmm. The people are the company are the people. And it's like super, super important. And it took me honestly probably a year after I met you to really understand that, especially as you helped me to start hiring my go-to-market team, and who wouldn't be anywhere without, who brought like a wealth of experience and knowledge, and I'm incredibly grateful and thankful for. And that's when it occurred to me that I thought your idea to actually start investing professionally was super smart, very genius, because your business accelerates quite dramatically because you receive pretty deep industry expert knowledge and go-to-market skill sets, when I don't know if I was deserving of that at that time, to be honest. Maybe I was, but I didn't think I was.
I thought you were.
And I mean, that allowed us to go and get into big accounts really early on. That has a big compounding effect. And I would say, so that's when I realized it's like, this is pretty interesting. And so I was super excited for you when you started MVP, and often, like to, and hope, I think of myself as someone that you can always, chat with about ideas and what we're seeing in healthcare, what's interesting, what's not. So it leads me to my next question, right? Which is, I think it's a rite of passage as you go into the venture capital world to start to develop a thesis or a thematics for how you're investing. And one thing that you said that stood out to me was you noticed patterns. And a lot of venture I've noticed observationally myself, a lot of it is pattern recognition. Do founders check certain boxes? Do companies check certain boxes? One of which, by the way, people always say like, oh, the team. What is the team like? Especially early stage. So it's like almost an unfair advantage when you know you have connectivity to create a great early stage team. And the beautiful thing about venture, it's like 1,000 times better in my opinion than giving your money to charity, because you're literally creating new jobs, you're creating new opportunities. It's so much more meaningful, and you're creating companies that create better things for people, better outcomes for people, things that are less expensive, things that are easier, things that are better. So I look at it in a very positive light. I don't think that everyone always does, but I think it's a good way to look at it. So I love what you're doing. So brings me back to my question though. What are some of the themes that you have developed, or theses that you've developed? Have you seen them change and evolve, or how do you see them changing and evolving with some of the new things? Let's try to refrain from talking about AI. I think it's overplayed a lit, unless we have to.
I stay away from AI, and I can explain why. Me personally as an investor, but I will stay away intentionally.
So tell me about your themes. Tell me about the patterns that you've noticed and what you like, what you don't like.
Yeah, I think what's interesting is none of these are my personal opinions only. Like Manny and Jason have been the most amazing thought partners. And what I'm most proud of MVP is it is a complete collective effort of over 500 members and growing that all share the same passions and same interests. And a lot of our ideas, a lot of our theses are based on thousands of conversations had with benefits leaders, benefits consultants and brokers, health plan executives, TPA executives, people from the PBM space, a lot of the people who've done the highest quality work in the vendor world, talking to people from the health system space, understanding like how health systems make money, how pharma makes money, how health plans make their money, and ultimately understanding like how all of those groups interact, how some help each other, how some hurt each other. So what we've heard from all of our many members and all these great contacts we've had is benefits leaders are absolutely hamstrung by the increase in premiums year in and year out. Like 10% plus premium increase year over year is unsustainable. It's why healthcare has been a key topic in presidential debates as long as I can remember. So our thesis is we want to support companies like yours, obviously, that drive real value, have customers willing to sing their praises, have a guaranteed ROI. They go fully at risk, or they say, hey, like we don't make a cent unless we get certain outcomes or certain cost savings generation. Because ultimately, the really unfortunate thing about digital health over the last 10, 15 years is some of the companies that did the best financially from an outcome standpoint, their customers didn't benefit as much as the execs and the investors benefited off the company exiting. And that's what we want to change. We want the companies that do the best financially over the long term be the ones that are driving the most value for the end customer. And unfortunately, and I'm not picking on anyone because I think it's just across the board, health plans have sold their clients solutions that haven't worked all that well. Brokers and consultants have recommended certain solutions that did not work overly well, percentage-wise. Same thing with the PBM formularies. You can go, pretty much any vendor ecosystem. I'd argue any group has probably done better than 10% of their implementations go swimmingly and their employers are thrilled. So I think we're in this really unique inflection point where benefits leaders need help more than they've ever needed it before, but they don't know who to go to. They don't know who to trust. So what we've created at MVP is a group of people who are hell-bent on finding these early stage companies driving real value for the employers and occasionally health plans as well, who are willing to go out in the open and say, hey, this is an awesome situation and implementation. We couldn't be happier. We're seeing these savings. This is the best thing I've implemented in 5, 10 years. And through that type of grassroots transparency crusade we're on, we want to really be able to identify and call out the good actors in our space that are actually moving the needle, for these millions upon hundreds of millions of lives that are within both commercially insured as well as fully insured populations.
So it's interesting. I want to broaden it a bit, and I want to ask you more so about like what's going on in healthcare. So right now, healthcare is like really top of mind. People are talking about like individual plans, like they're paying $50,000 for a family of 4. How did we get here? I want to ask what the problems are, because I want to ask you that in the sense of like, where do you think that there's opportunities to expand, right? Healthcare is 20% of the US GDP, but that's kind of like a gross overstatement of healthcare, right? Because healthcare is really segmented into a bunch of sub-industries, right? You have based on the buyer. The buyer could be a hospital system, it could be a payer, it could be a outpatient physician, whoever, right? So what are the things that you've noticed in healthcare that are the biggest problems to date that are driving up these costs? Because in my opinion, I think that sometimes people go after the messenger and the messenger is just the messenger. And a lot of the times I think of the payer as the messenger because they're taking on costs from someone else. They can't even take more than a certain amount of profit, of course, as we know. So where do you see the biggest problems being, and do you see anyone addressing them? Are there things that you're excited about?
Yeah, I think there are certainly perverse incentives, in the healthcare market. And I go to a lot of industry conferences. I went to one in particular in California, I think in like April or May of 25, and I found it really interesting. Health systems, health plans, and pharmaceutical companies and like PBMs, those are two separate things. They all kind of sang the same song. They mostly had the party line of we're making minuscule amounts on our Medicare and Medicaid populations. So poor us, we're going on razor thin margins, and we are forced against our will to gouge our employer commercial customers. And what I think is very interesting about that is number one, none of them are talking about lowering their own costs and the ways they can operate more efficiently. It's all just how do we keep our margins, on what we're already charging for, which is disheartening in the first degree. But I think what's even more, I would say, disturbing is that it's not as if they're raising every single thing that they charge for equally. They're choosing very specific service lines to price gouge their employer customers. And again, I have a very biased view because I'm very employer focused. I have a lot of loyalty and a lot of admiration, for benefits leaders. And I also feel like they're the ones who've gotten the short end of the stick, in this whole healthcare ecosystem where I would argue health systems, health plans, pharma, PBM, they don't mind the status quo as much as they'll say otherwise. So what we're seeing is they tend to create their high margin service lines in areas where they can refer patients at a high rate. So again, that's why we loved OneImaging, because we saw that people usually listen to their doctors because most healthcare consumers are not overly educated and informed on healthcare decisions, and they assume their doctor has their best interest at heart. I think doctors have their patients' health at best interest. I have no doubt about that, but I wouldn't argue doctors are overly incentivized to send their patients to a cost-effective option. I think they get a lot of downward pressure from their larger entity employers, the health systems, the large, ambulatory provider groups that have certain services in which they drive a lot of their margin and revenue. So I would say that is, I think, the biggest issue is organizations, whether they are pharma, health plan, health system, the whole large cost items of an employer plan. Unfortunately, they've chosen certain service lines to really upcharge people on. And what we're trying to find is what are those areas and can we carve them out using, OneImaging for radiology or a Leap Health for infusion therapy, or we're excited to see the next service lines that come through. And again, when we were talking, when you first told me about OneImaging, it reminded me a lot of one of my top clients, Carum Health, them, their main competitor, Lantern, Transcarent, they all have done this in surgery and cancer. And now, like you at OneImaging are taking that baton and running with it in a new service line that tends to be high margin, for these health systems.
Yeah, it's quite interesting because when you describe it that way, it almost seems that we're double subsidizing our own care. So like for me, as I've been studying kind of the broader healthcare ecosystem and like the trends I've noticed, we have this massive aging population. It's why so many of our parents told us to go into healthcare. They're like, oh, you're going to have job security in healthcare because there's a huge baby boomer population.
Yeah.
The irony is that as we've chosen to have a system that is socialized, which is Medicare and Medicaid, right? That ironically, the payment model in that function didn't have the outcome we expected to support that older population, which I'm for supporting that population. Of course, I have 2 retired parents, but in the sense of really, we're also in addition to paying into Medicare and Medicaid ourselves, just like Social Security might go belly up by 2032. Medicare, Medicaid is
so scary.
Pretty much in debt. That pool of money is actually not even there. The irony there is not only is that pool of money not there, because of bad actors. But the irony is that now on top of it, the entities providing care that have to provide care to Medicare, Medicaid patients are actually now in addition saying, hey, we're actually also going to charge more, to support the lower reimbursements we're getting there, which is what you're saying, which is crazy that it's essentially a double tax, double subsidy, if you will, which kind of sucks.
Inefficient, let's just call it that.
And the easy button for people, I think, unfortunately, is like, let's hit this easy button that just says, if we just make one person, one entity, i.e. the government, just control all of it, go single payer, everything's gonna be great. Well, we've seen like how that works out. Do other countries have the best doctors, the best surgeries, the best med tech, the best infusion drugs, whatever it might be? No, they don't. Are they waiting 6 months to get an MRI like they are in Canada? Yes. People are going to push back, whatever. It is what it is. That's how I feel. We have CON states where you can't build new centers without approval from the state. It limits supply for growing demand. I think I recently read something crazy too, which is like the amount of licensed doctors since the 90s hasn't increased, but our population since the 90s is probably at least 100 million larger. Like that's insane. Plus the amount of older people that need care. So we have like huge supply demand constraints and limitations, inability to create new centers, double subsidization. I mean, the list goes on and on. I think I was, explaining that to you. And then the crazy thing is we have this administration increase of 3,000% since like the 70s or 80s compared to like doctors. So this large gap and people are like, okay, where are all the costs? So when you look at all these things, right, and these rising costs, outside of just the employer space, are there any things that get you excited about, hey, how do we address that? How do we create bigger impact? How do we create impact outside of that? Are there any things that you've seen that perk your ears up?
Yeah, I think, again, behavior change is such a huge piece of healthcare, and we need to participate in our own rescue as patients. Ultimately, like, it is our responsibility. What we put into our bodies, what we're eating, what we're ingesting, what our exercise routine is. Are we getting outside? Are we moving our bodies? I think what we really want to do as healthcare leaders is practice what we preach. Like, are we living a healthy life while we're building these companies, while we're helping scale these companies? So again, I'm a big fan of prevention, and I think there has to be a behavior change component. I think there has to be like a cultural zeitgeist of health as an investment. And if you invest in your health, you're going to get the rewards. If you don't, you're going to pay the consequences.
Yeah, our obesity rates are like 70% now. Like, we all know where that leads.
Yeah, and it can start at, the school lunches and like what people are exposed to and what cuisines and what they feel is like a normal plate and portion size. And there's just so many societal factors that kind of come into play when we're talking about chronic disease. So I'm really hoping over the next, 10, 20 years that this next generation of, children and young adults start prioritizing their health and not treating it as if they're a victim, but they're also, part of the equation and do bear some responsibility for the good and bad of their health situation.
I don't know if this is the case for you. I'm assuming it may have been, but my parents hate when I do it, but I poke fun at them because I think about how crazy it was that I ate cereal filled with sugar every day for breakfast before going to school.
I'm sure elementary school teachers really loved you hopped up on energy with a sugar high coming in ready to raise havoc.
But I think about how crazy that is, right? As opposed to having like, eggs or something. And hopefully we see that be a part of norm, no pun intended, the norm for kids to not have cereals or something like that. Or when you think about your nutrition classes, right, growing up, we had this is probably a huge throwback, but I think about how crazy this is sometimes, that food pyramid triangle. Can you imagine in there it was like, oh yeah, you can have like a ton of as much carbs as you want pretty much. Like you're good, don't worry about it. You
building
desserts like
of a healthy diet.
Yeah, pretty insane, which we now would like if we looked back on it and saw the actual written material in a book, we'd be like, who is doing this? This is absurd.
And who subsidized those studies? Big wheat, big farming. Like, you got to look a little bit below the surface in a lot of these things. And, some of them are unintentional. And I think, like, this is a good example of kind of how we can have the right intentions, but we like kind of lose the spirit of what we're actually trying to accomplish. Is like my grandparents, your grandparents' age, some of them grew up very poor, and like meat was a luxury. So when they became successful and raised their economic status, they felt, well, I only got to eat chicken or steak or fish once a week. If I can give my kids steak and chicken and fish every single day, every single meal, I'm a better parent. I'm doing something that my parents didn't do for me, and that's me showing my love. But ultimately, that wasn't a healthy decision. I don't think anyone should eat meat every meal of the day, every day. And that's how I used to eat, interestingly enough. And then I started to have gastrointestinal issues and, started to do a little more research and, kind of fixed a little bit of my own bad behavior. So again, with the best intentions, sometimes we don't get the right results, but we have to course correct. We can't just assume like what we do now is what we should do forever.
Yeah. So Norm, I'd ask you a big question though. 2 questions to wrap up. One big question I want to ask, what do you feel like makes MVP different?
That's a really good question. So we were laughing about our first interaction and what I was thinking and what you were thinking. And when I told you I wanted to invest, I did genuinely want to invest. I also didn't know the amount I wanted to. And before you were willing to take my money, I do recall you were like, well, how do you bring value? And how is this going to be helpful to the business? I got to like sell it to the other investors, which of course you need to do. And I explained to you, hey, like when you get me, that's helpful, but you're also getting my network. And I think people in my network can be helpful. And also I said, like, yes, they can be really helpful to you. They can also help me evaluate it. And I'll feel a hell of a lot better writing a check, and probably a bigger check, if I hear from these specific people that they think you're onto something really crucial. So upon meeting you, I remember like within a couple of days, I'm sending out texts at Health. Hey, will you talk to the CEO? I'm really bullish on. You were talking to a commercial executive at Transcarent, COO of Carum, someone very senior within corporate development and partnerships at Hinge, Progeny's product leader. We had you talk to, another musculoskeletal company, another COE company. We had you talk to the Teladoc Livongo, like all channel team. And then we had a very senior consultant at Aon and Willis take a look at it. Obviously for you, that confirmed, okay, Norm is well connected. He might be able to, pull on some strings occasionally to get us a piece of advice or an intro here or an intro there. But when all those 9 people came back to me and said, Norm, you've really got something here. Some of those vendors started partnership discussions. One of those consulting and broker firms signed a reseller agreement like within a week of meeting you. The other one, had a lot of commercial executives within the business, and product experts and COE experts, take a look at this and, got a lot of exposure. So let me kind of flip that into why MVP is different. You gave me the opportunity to invest that first time, but I would have loved if all of them were able to invest. But you explained to me the realities that, hey, when you're a founder, you do not want to complicate the cap table. Like every new entry on the cap table makes maybe the next investor a little more reticent to get involved. So that, again, totally understood it from your part. But for me, it felt almost hollow because I want to participate with my network. I want to help the people who help me. So that's when the whole idea of creating MVP was, hey, should I meet these great founders and great companies and, something I feel really passionate about helping, how awesome would it be if I get to help that company along with my best contacts, the people that know this market well, are passionate about it, who have connections that can help the company way more than I can, and that the collective effort of many can then generate amazing results. So obviously I had to get the leadership team in place. So like Manny Menendez, Jason Perot, they were my dream business partners. And I still to this day pinch myself that I get to work with them day in and day out, same as I feel about working with you, day in and day out. But what was really special about investing in OneImaging in January of 25, we raised $850K. But what is really exciting and what I felt most proud of, it was from over 80 investors. And that amount of people in industry who all have now a vested interest in helping OneImaging scale and grow and continue to iterate and improve time and time again, quarter to quarter. I think that's part of what has allowed some of this explosive growth. I'll let you kind of walk through what degree you think that was helpful. But I think that just proves the collective effort is way more impactful than one or two, people without like that scale.
I would say we definitely have some fans out there as a result of it, to put it lightly. So that I would say, yes, that's been helpful for sure, and it's been awesome. And it's cool to see the digital health ecosystem, the digital health community actually come together rather than beat each other up over nonsense. Like, I mean, obviously, like there isn't really an imaging company doing what we're doing, particularly, especially how we're doing it. So like, there's no reason to beat down on someone or beat down on a new company, especially like when they're getting going. So it's great to have support. So I would say it's been amazing to have that.
Yeah, so it's just so fun to see that. Like, I go to a conference board and I'm like, wow, like half the companies exhibiting, we have an executive that invested in this deal. Oh, there's a bunch of benefits leaders here, like handful of them also believed in this, like very, very early. Same thing with benefits consultant brokers and every other like entity within the space. And that, in my opinion, is what also sets us apart, is our due diligence and our pickiness. Because most venture firms are fans of the power law, and the power law is real. Their goal is, let's diversify. We're going to have a couple winners that really like take the portfolio and make it a winner. And we don't know who the winners are necessarily going to be. I almost go a little bit more of that VY approach as you described. Like, we'd rather do only a couple of investments that we feel really, really good about. We can do a ton of due diligence on. We can do a lot of confirming up front so that when we recommend it to folks in our network, whether they be benefits consultants, benefit brokers, benefits leaders, health plan execs, it works as intended every time. And that's what we want to be 5, 10, 15 years from now at MVP, is the group with by far the highest hit rate of when we recommend something, it works as intended. And there's no question of, hey, is this going to work or not? It's more of, what have you found next that meets your criteria and can stand up, to your scrutiny?
No, it's thoughtful. I agree.
Thank you, Elan. It's been awesome. And I like this little change up we did.
Yeah, it was fun.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.